Well, hello everyone. I got the doc with me again, and we're tearing through your question and answers, I think, here. And so, excuse me, we're just going to keep on going, I think,
Keep
don't
going.
you?
That's
keep
right.
on going, Doc.
Yep.
Well, I just got this one in. It's from Alex. And I'll say this to you guys. If you want these private without your names being read, you're going to please mark that before, because I just grab these and read them. So, and that problem with an old country boy, we get some of these medical words that are that long. I'm going to have our trouble with that. But this is from Alex. Hi, Alex, my friend. This is, sorry again for your English. Your English is perfect, Alex. You don't bother me at all. You don't have to say that. Your English is great, man. You don't talk about bradycardia in your videos, mainly about tachycardia. Well, what he's talking about, bradycardia is a slow heart rate, and tachycardia is a fast heart rate. And the thyroid controls heart rate. So you're generally looking at the weaker the thyroid is, the slower the heart rate. And you can get into real hypothyroidism and your heart rate go real low. And if it goes below 60, they're going to want to stick it like that new little pacemaker they got out. Have you seen that new little pacemaker? Before, they dropped some hooks in your chambers and hooked the chamber. And now you got wire stuck hooked in your chamber forever. So bradycardia, though, you want to get your thyroid up. You want to improve your thyroid function. I would also go brain and nerve to enhancement, and I'd also go to the adrenals. Why the adrenals? Because that's the nervous system that controls the heart. It controls the depolarization and the opening of the mitral and tricuspid. That is the autonomic nervous system controlled by the adrenal glands. So you're going to go that way, obviously. That's the neural impulses, but the thyroid controls rate. So that you're going to go and increase your thyroid. Do not forget to take a little peek upstairs at the pituitary. With a male, it's kind of hard. With a woman, you know immediately if she's having irregular menses, bleeding heavy, things like this, you can go right to the pituitary. With a male, it's kind of hard. You just have to fish through all that. Eyes tell it best. What do you think about a person who have high blood pressure and bradycardia at the same time? Well, very possible. Just because the kidneys are in trouble there and you're losing the kidneys doesn't mean that that's going to make the heart pound too. It's possible, because we've seen that too, associated tachycardia with that as well. I've definitely seen that. But I'll say this, you're probably working on a thyroid problem, or you have some incredible blockage, lymphatic blockage to neural impulses. You have to realize, and I've said this before, if you ever, and you're the body lady, you know the body works. She's incredible, chiropractor, British chiropractor, a homeopathic physician. She's got a lot of labels.
Bowen therapy.
Yeah, I mean, this
awesome.
lady's got it all. She worked on me at one of our classes, and it helped me through the whole class. But you always want to get in there and get your endocrine glands healthy. But think about this. You ever lay on one side and maybe, or just not even lay, just start to get numbness in one hand or both hands. You feel real tight up here. That shows you how the lymph can get tightened, and of course it gets dehydrated and takes on water to hydrate, so it swells, but it tightens because it's acidic, and you just get tight as a rock. But it suppresses nerve and can suppress blood flow. Blood a little deeper, thank God, arteries, but it can get to the nerve flow down the arm. So you can get numbness down this arm from a real tight lymph, and I suspect the same thing in the heart, neurologically speaking. You get that lymph node. But by the time you get up there to the right atrium and the SA node, I would think you would have irregular heart rate then. If it was a lymph affecting nerve impulses to the heart, I would see that you would get out of sinus rhythm and go into an arrhythmia of some sort. The only other thing, I do not think the parathyroid would have any effect on TAC or bradycardia, but it would on AFib, atrial fibrillation. That'd be a calcium issue as well. Excuse me. When you take lots of plants, don't you risk to overdose? You know what? That's a good question. No one ever asked that. I'll say this. You know the nice thing about eating raw, or even taking herbs, you can't the herbs you can't take too much. There's no question about that. But I think that we've had so many years at administering them with dosages and everything, we rarely see that. Although most of you, and we talked about that earlier, how sensitive that you become to your body, especially people like you, body workers, energy workers, stuff like this, very sensitive. They know immediately chemical changes in the body and everything else. And so,
I think if you did something too quickly, so if they jumped in
too quickly,
too much too quick, then they could run the risk of feeling, that sort of.
It's a good point.
Flux of
Too
the
quick.
body.
And
Yeah.
I know some of you
To be
need to jump
careful.
quick, but she brings up a good point about going too quick. That's why the detox kit, that's why that basic kit,
Go
weeks 1 and
slow.
2, just an opener, opens all the doors. It's still aggressive for some people, but it's enough to really open all the doors, take a look around, that sort of thing.
Yep.
Get it fit on the diet. We don't care if you cheat liver because it's just what you said. We need to move them into, get 2 weeks down the road, look around, see how you're doing, start going a little deeper and faster, that sort of thing. Depends what you got, how much suffering you're into, that sort of thing, how much time they give you to live, that sort of thing. But with eating, you can eat fruits and vegetables till hell freezes over because the body will excrete any chemistry because most of it's water solubles. You have to worry about your fat soluble type chemistries because that is your lipids and they can build up. So when you're dealing in a plant that's very high in lipids, you can overdose. And you have to be real careful about that sort of thing. Lipids can, your body can excrete generally plant fatty acids and stuff like that, but you have to be careful with that. You can tell, put it this way, you can tell when you've reached it with avocados.
Yeah.
At a certain point, I know my lipid. You just know.
Yeah,
you can
is.
feel that. I'm done with my lipid.
For a bit. Yep.
Exactly. You can
Yep.
feel that sort of thing.
Just being body aware.
Yeah.
Okay.
Why does certain plants are poison or neurotoxins, like Datura? Well, I couldn't tell you why God created every single plant. And why some are neurotoxic, some are excitotoxic, who knows? I'll be honest with you. You can't eat every plant. There are toxic plants, no question. Toxic mushrooms, there's toxic all that. You have to ask the big cheese. But it's enough to say that there's been enough people dying and stuff with herbs through the years, which isn't really true because I don't know, in the earlier years when they were really getting into herbology for the first time, maybe from the caveman days, who knows, if people did die from experiment. Oh, try this plant. Whoops. Whoops. Guess we can't eat this one. That's possible. Thank God I did a whoopsie here with my hair with the Peruvian bark. And I do recommend no one to try Peruvian bark. Just don't even go there because it will mess with your happiness big time. That's quinine. When you get these plants that are high quinine, we shouldn't even have them in the herb books. And Christopher has Peruvian bark in his master herb book. And it needs to go because you don't even want to know about that. Or best if you don't eat, unless you're an herbalist, it's best you don't even know about some of these herbs because they're real strong. And the problem is, with some of these strong ones in low dosages, they're incredible. Their actions are incredible. It's like Peruvian bark. Supposedly, in low dosages, is a neural regenerator. In high dosages, is a neurosuppressor. Neurotoxic. So, but it's finding that dosage, and I decided years ago I would never put you guys through anything like this, that I would never put any herb that had that suspicion that you might take too much of. I refuse to do that.
Yeah.
But it's the way God made everything, and the way, of course, plants themselves have come up and mutated and increased their life that way. I think you tell that the hemp plant is a neurotoxic too, somewhat. I mean, marijuana is a little bit of a neurotoxin. Seems to move through pretty quick and stuff like that, but you notice that if you're a marijuana smoker, make sure you have a little higher blood pressure. If you have 90 over and you're a weed smoker, be careful because at 90 over you're already pretty low neurologically, and so you could really get yourself into some deep areas of unconsciousness. Maybe.
Do you think of hemp as a
not hemp itself?
No. So hemp as a protein,
yeah, as a plant. No, I don't. I don't think of the plant as a neurotoxic plant.
No.
And of course, but ingestion of that plant in certain ways.
Yeah.
Yeah.
But the hemp hearts or the hemp seeds, they call them.
No. I have hemp powder
Yeah.
in my infant formula.
Yeah.
I put hemp powder, and then of course you all know about the hemp oils, and all that they're saying. Look at oils as anti-inflammatories, if you will,
Yeah.
or antacids.
Yeah.
So that's
Yeah.
why you see the beneficial effect of using hemp oil in cancer cases, because it's a high what condition,
Yeah.
high acidic condition. So oils are anti-acid, which is anti-inflammatories. And so that's why they're beneficial. But we just got talking about too many oils
Yeah.
can get you. And of course, the FDA came after Gerson for that, and that's vitamin A and beta carotene, 100,000 units, and at that level they considered that too high. In America, we don't. The FDA doesn't allow. I hate that word. The ingestion of essential oils. Germany, maybe a few drops. So you just have to be careful with some things are potent and strong, and you just have to be guarded with that. You know? My mother told me that she has irritations and blood in her stools when she eats ginger or pepper. How is it possible? Ginger and pepper, very stimulating to the mucosa. And it would not be possible if she didn't already in trouble. So what this tells you, my friend, is your mom's in trouble. She's got a lot of inflammation in the bowel wall, which means her lymph system's backed up interstitially or in the bowel wall, and it's burning on that. So her tissues are very inflamed, shall we say, and very sensitive. So anything that's a little aggressive to that mucosa,
irritating,
exactly,
is gonna it's gonna wind it up even more.
exactly.
Isn't it?
Exactly. But what that does tell you, don't you think, is that she's in trouble. She needs to fix her
She
GI
needs
tract
to.
up a little
Yep.
bit. So you want to get her off all the proteins. That's when you really don't want proteins, is when you're getting GI bleeds like this. Even with a little ginger and a little pepper. Remember, on these type of hot things, especially peppers, a little dab will do you. A little pepper will stimulate blood flow and everything else, dilate the capillaries. Too much pepper causes mucus. You know, too much pepper will make your mucosa produce mucus. It's too corrosive, too abrasive. So, you know, that's saying that if a little's okay, a lot's better. No way. No, that's not true. Why is nature trying to kill us with poison? It's not. Although it's been a big learning curve. But take a look in the last 5 years. And I know Gary Knoll's been doing a lot with this, and a lot of docs have been doing it, a lot of medical doctors have been doing this, but we were putting together a lot of cases because we were fighting, we wanted to go after the FDA, and we still do. But we were putting together cases where they've been killed by pharmaceuticals and all this sort of thing. And, oh crap, I forgot what I was going to tell you about
So
that.
why is nature trying to kill us with poison?
I know, but you
Yeah,
know what I was going to tell you went right out the thing. It's enough to say, if you look in the last 5 years at the amount of deaths occurred under naturopathic practice, under herbologist practice, homeopathy practice, and allopathic practice, you had zero, as far as I know. If there's one, maybe one, but you have zero in naturopathic practice in the last 3, 4, 5 years. None homeopathically. That's about as safe as you can get, basically. So really, there's been no deaths reported to the disease control centers, the CDC centers, but on the allopathic side, over 1 million last year. Is there something drastically wrong with this picture? If we had 10 deaths, which would be staggering for me, I couldn't sleep if I had one from what I caused. But 1 million? I mean, I hope this is. I don't think minds can comprehend the amount of deaths being created through pharmaceutical use, wrong surgery use, medical doctor stupidity, etc., etc., etc. I don't see how you can say that's a viable science when it kills over 1 million people a year, and half of it doesn't make any sense. I think it's radical. I think it's alternative, and if we can't get you, you better look up a medical doctor. But it's not the other way around. Once we're cleaning up their messes. So not to insult you medical doctors that are listening, it's enough to say you need to get into our field now. And really, if you're a healer in your heart, you want to join us. You don't want to go down that same path because karma's going to whip, and the oncologists are going to get whipped real bad with this. Guys are probably going to go to jail for some of this stuff. So I would back away. You know, we're so used to, it's like the mind. You get used to certain patterns. People think they're safe. They go along, and suddenly life comes awake and serious problems. So you see the difference. So nature's not trying to kill us. It's man that kills himself. You know, we've had a little learning curve because how do you experiment with herbs? Let me try it. Oops. Or, oh, this is good. But we've learned all these years, so...
That's over, yeah.
Yeah, we're good. I mean, I think we're really good.
Many, many years.
She told me again that oranges are cooling the body, and when Eskimos eat it, they die. Is that true? What do you think about it? When Eskimos eat oranges, they die? Quit it. It's like telling me that dogs die when they eat chocolate. Or grapes. Grapes kills dogs. Are you kidding? My dogs eat grapes. Everybody's dogs, a lot of people's dogs eat grapes. But there was a big thing on here early on where grapes kills dogs. And it's like, they're omnivores. You know, what from a grape kills a dog? They don't. And the same thing with any of that. There's so much misinformation out there, guys. That's all I can say. There's so much information about this. She wants to be anonymous. I took her name off everything. Okay. All right. Okay. This is from... Uh-oh. Yeah. I won't read it.
That's the anonymous.
Okay, that's the anonymous.
Okay. So
we'll stick her on the back, no offense.
Okay.
I am so sorry to ask another question, but I am really unsure about this one and was hoping you could add your opinion. I have been high raw about 95%, which is very good. Congratulations with that. Yeah. You guys are doing great. Listen, I'm patting you on the back at 80% raw. So that's how good that is alone. And some of you guys are just unspeakable. Unspeakable. And your eyes, oh my God. Her eyes, how long does it, what's the time period?
It's been 2 years, two and a half years since
now,
I got them done.
Drastic changes?
Yeah.
Drastic changes. Her lymph system was a mess. When we first took her pictures of school, oh my God. It's just unbelievable. Unbelievable changes. But there's a strong constitution right here, and she just made major inroads. I mean, this is like night and day. It almost doesn't look like the same eye, does it? No, it's amazing stuff. Be proud of yourself. That's some cool stuff. All right, so for the last few weeks, he's been doing 85% raw. Very few cooked vegan meals every 5 days or so. That's about how you do it. Good job. I had a terrible detox headache last weekend and have been experiencing intense back pain for days. Mm-hmm. Kick it up another notch. That's what I have to tell you. Don't back up. Go forward. Go forward. Dig deeper. Put yourself on a great fast. You got a headache anyway. Put yourself on a great fast or lots of fruit. Clean that bowel out. Get on the GI tract formulas. Get on your kidney formulas, your endocrine gland formulas, because you either got a stomach headache, you got a sinus headache, you got a thyroid headache. You know, either of those. I had my actual breast thermography done so this is a female, on Monday. My breast looked normal. It did. I looked at these. Yeah, we looked at this thermography.
But the back, remember?
Yeah, the back was real bad. Yes, yeah. We saw that. The breasts are perfect, which is great, but you're not draining down the back. Neurolymphatic points, big time. Now, if you were at her place, she could take you. She could fix you up because she knows how to move that body like nobody's business. But you've got to use those neurolymphatic points. Get your husband, your boyfriend, whoever, get up on your back and start working these neurolymphatics. At the same time, get yourself a little higher on this program. Start draining that lymph because you see the back. Let me show you this. We got pictures for you. Yeah. We good?
Yeah.
All right. Now, I don't have Drew here to help me, but all this red, thermographies are so much better than mammograms because you know you're not going to walk away with potential radiation burn to cell and cancer cells. But look at all this. I don't know if I'm pointing, but all this red is down this lady's back and around her neck area. And right where the lymph system is, right where the lymph system goes down, everywhere under her breasts, these are all lymphatic stagnation points for females. And of course her axillary arm, her lymph nodes are showing up. So yeah, you're highly involved here lymphatically and down your back. So you've got to get these axillaries open. It's just getting the kidneys open and draining on this, hoping that the lymph nodes will filter okay, that sort of thing. But we looked at this, didn't we? And it really didn't didn't look bad. I thought it was pretty good. Generally, the breasts are involved too, so you're a lucky woman. But you got to get that back opened up and get this whole neck and everything opened up. Hot and cold applications.
She said, would it make sense that as the acids drain from my head, that the back would be inflamed?
Yeah. Yeah, but you also could have stagnation there and not allow the head to drain, particularly the cerebellum, because this can get real tight and stiff in people. Yeah. And you know, things become a rock the more acidic, the longer things harden, anionic. So this is why, and it just takes a while to loosen that. So I would loosen stuff.
And also, she had a car accident.
Oh.
So that could be.
That's right.
If
as
there's
a teen.
any whiplash or any. Right, so the body is not.
This is the lady
properly.
you would need to go to help open up that,
so
and
it could
then
be congested through there.
Exactly.
It's just not moving
exactly
well at all.
As a teen too,
Yeah.
and used to have golf ball size. Oh my God!
Boils.
All right, I don't have your eyes, sweetheart.
Especially on her face, Larry.
Oh my God! She says, you say it all right here. You say it all right here, sweetheart. This is what she says. She says, and used to have golf ball size boils all over my body. Now. This, you show perfectly that the lymphatic system is a systemic issue, and that when you're backed up one place, you're backed up all over the place. But that shows you how bad your lymph system was. To have boils popping up all over, at least your body was taking them to the skin and out the skin, because you could have had internal tumors.
Yeah.
And maybe do, but it's enough to say that this is obvious, especially all over her face. Anything you think up to loosen this up? This coupled with antibiotics. Oh my God! A few rounds of Accutane.
Accutane.
That's a bad drug. Now you could probably get in on the lawsuit on that one. Made my system very acidic, resulting in major bowel inflammation and a laundry list of symptoms. I bet. So you got to go right to it. You go to the adrenals. You go to the kidneys. You go to the lymphatic system. You go to the GI tract. And this is what we've been talking a lot about this today, coming in our face a lot here.
Yeah.
That you have to address the GI tract, you address your kidneys, you address your adrenals, and you start hooking on that lymph system. I would suggest in what you're saying here that you kick it up another notch in your diet.
And also be patient, because she,
Yeah,
you know, it's still new for her, and she,
Yeah,
you
it
know,
is.
The body is
That's a
well
woman's touch.
understood.
We need someone not near as
Well,
aggressive as me, because I'm bad.
I know you're wanting to, but it.
Yeah, you're right.
You know, healing is a process, right?
It is a
and It has
process.
to,
And I think she looks pretty good, but you see the head here?
so I'm looking at all the misalignments too. Yeah, she could do with some body work for sure.
And you can see under the breast here, see the red under the breast there? That's common for females. And they can ooze here, especially the larger breasted women, and when you're very toxic, your lymph can ooze under the breast. You can see under her arms.
Yeah, some real hot spots there.
Yeah.
Especially on that rib.
Yeah. See this one in particular. I don't know if you can see this, guys, but you see under the arm there, the redness there. These are thermographies. And I think they're cool because you can see everywhere acids are built up there. She's lucky with the breast tissue and the side. Look at her. She is lucky. But at the axillary arms, it's the necks and the back you're really involved in. And that you just really hit the lymph system on that. Yeah. Here's a little bit bigger picture of her back. I hope you can see this, guys. Sorry if you can't. We don't have Mr. Drewski to help us. So, I think that's...
Well, so keep going, girl. You're doing
Keep going,
great.
girl.
Yeah.
Yeah, and get up there. Maybe maybe go on a great thing. A great fast. I'd kick it up
grapes,
another
yeah.
notch. In what you're saying, I wouldn't back up the other way. This is Organic Superman. He's been with us since the beginning almost,
Okay.
a good dude.
Yeah.
Dr. Morris, how would you deal with circulation problems with hands and feet? Well, a couple things. We were just talking about how you get impacted lymphatically and how that can affect good blood flow. But a lot of times people have adequate blood flow, but they have thyroid problems, and so their hands and feet are always cold and they look like you have poor blood flow. So I would use circulation lower body And I would also use get my thyroid up, check my basal temperatures, and get my thyroid up, and get that rocking and rolling. I find that a lot of times when people think about circulation formulas, it's really the lymphatic system that's impairing the flow, adequate flow of blood, or nerve even. So, every way I cut this, I keep going back to.
Well, you can
the
check
lymph
the
system.
pulse. The pulse would be great to the foot.
That's right. you
Right,
can check
but
the-
it's still
There you go.
cold, so it's not circulation. It's
Exactly.
Yeah,
Check the
it's
pulsing
yeah.
and the redness or the purpleness, or there's no color at all. Oh, it's white. That's not good. What could be the issue causing this? Thanks. I am considering using raw glandulars for a short while to see if that helps. Well, you know what? I would do the thyroid 150s. Don't get us strong. Would do 150 milligrams at the very most. Do one in the morning, one in the evening, and see if that brings you up. Check your basal temperatures under your arms, Organic Superman, and see what your body temperature is telling you there. I am sure the gland, help improving immune system function and any other. They're super good for the adrenals. That's all I got to say. And all these other glands at a quicker return. Because I think we were talking about earlier, you noticed and I noticed that,
Yep.
you get such a better return with that glandular over an herb. I love the herbs. That's not the problem. It's just that if you're in a serious need and a stat need.
Yeah, it can nurture and nourish
Yeah,
quicker.
exactly. Like
Because
that.
you're giving like for like.
Absolutely.
Yeah.
Exactly.
Yeah.
You're right on, honey.
Like homeopathy.
I don't like homeopathy. Yeah, I know. And a homeopathic physician would. I've said this to all of you. I think every medical doctor should turn in their medical badge for a homeopathic badge. Homeopathics is the best science of treatment there is. The Queen, of course, is a stickler with homeopathics, and I don't blame her because it's a safe way to treat symptoms. It's a great way to treat symptoms while what? While you're fixing the cause of the problem. So what do we think of
What
it?
have we got here?
Thank you very much for what. Thanks. Say so much, guys. I really appreciate your loving feedback because I love you just as much. And this is. I can say this name.
This
This
is
is Monica.
Monica from Lithuania.
Oh,
Wow.
Monica from Lithuania, Europe. I found your videos not so long ago, and I'm so much like to learn from you. I've always learned so much. Well, thanks, sweetheart. You know what, honey? And happy to help you. We're happy to help everyone. It's just we want a feel-good planet, don't we?
Now, this is an interesting question.
Okay.
Because this is where people don't really understand this wonderful system that they carry around.
Oh,
right?
what's
So
it
look.
say?
So she wants to know how the stomach and all this digestive system works, and if there are problems in it, how to regulate them with fruits and herbs, as the stomach is supposed to be acid. Aha.
The stomach is supposed to be a little acid, and for short periods of time, that's why bicarbonate comes in. Even an acid chamber like the stomach can become cancerous. Too acid, and you
It's eating
ulcerate.
tissue.
So
Yeah.
you can see where you can ulcerate with too much protein, with hydrochloric acid. Now let's take about the interstitial burn. That means the burn in the wall of the stomach, which is the lymphatic system. Totally different burn.
So she's having acid feelings in her stomach,
Man.
and her dentist said that probably those acids ruined her teeth.
Oh, give me a break. I will
Now
say
I
though,
feel
if I can,
myself.
what link can we make between what that dentist said? There's only one link you can make from your stomach acid causing your teeth decay. And what link is that? That's your lymph system. It's systemic. It's all through you. So it isn't the stomach acid that's breaking down your teeth. It's the acid from the lymph system that's probably breaking down your stomach and your teeth simultaneously. Same system, because when you're down in the lymph system, you're down head to toe. Because your stomach acid is not going to ruin your teeth. I mean, that's ridiculous.
Well, now she's saying that she's getting sore throats as well in the morning,
Well,
and feels that's coming from the stomach acids.
you know what? I mean, you could have some regurgitation if your stomach sphincter is weak or whatever, but I
Or
still
if you're
say
eating too late.
eating too late,
That's one of the biggest
absolutely.
ones.
Standing on your head in a corner too long. But I'll tell you the truth, most of these things are all the way up lymphatically. Your esophagus is swollen, inflamed, stomach is inflamed and swollen, small bowels. I mean, this is a systemic hit. You could have acid regurgitation, or you could have true GERD, and you would want to go to the pancreas for that. You'd want to look at your pancreas, and the best way to tell if you have pancreatic weakness, the quick way is when you eat fruits and berries and melons, do you get gas? No. Good. Now, do you get gas when you eat vegetables? Yes. Still pancreatic. Whenever you have any carbohydrates and you get gas from that, it's a pancreatic problem. And that's just the digestive enzymes. You might suspect low bicarbonate with that. And so you might have a little of that. The best remedy for that, stop all protein. And you should be stopping protein anyway. We preach enough about it. So you want to stop every little ounce of protein whatsoever. And you want to go, and this is also why vegetable matter is almost considered a protein, the amino acids. Not quite as compact as what we would call a protein, but real close. It's a protein to a herbivore.
And she's asking, so when people get refluxes, and then they tried to eat grapes or apples, they're saying that they get more acidity.
You do. That's a good point. So now let's read that. Now I feel my sore throat as from stomach acids in the mornings, though I do not eat baked, no chocolate anymore. Used to eat many. But what worried me most, I found 2 holes in my daughter's teeth under the gums, just like mine were. How interesting.
Okay.
Genetics, right? Sides of teeth. She is 7 years old. I try to strengthen her pituitary. Nights are wet nights. I got you. Yeah, and that would be a good idea. I'd probably at 7 years old, honey, put my daughter or son or daughter on a endocrine gland formula, because you might want to pick up the pituitary, but you might also want to pick up thyroid and parathyroid and all the other glands with it. So being a female, you definitely want to work with this. Hitting her pituitary at 7 years old might be a little strong. I wouldn't know the dosage of a glandular. So you would want to use like chaste tree berry, or the endocrine gland formula. That way you're hitting her gently and you're hitting her perfectly. But I'll say this, again, same hole in genetics. That's a problem with genetics. But what's putting the holes there? Acids, no question. But it's not stomach acid. It's your systemic acids. And it's all through your tissues everywhere. You have lymph vessels and blood vessels everywhere. Saturated body with lymph vessels and blood vessels. And it's the acids from your own cells that are breaking you down here.
I wonder if because I know apple juice,
Apple.
but not the raw apple, not real apple juice. If they're having too much of that concentrated apple
Yeah,
juice,
you know what, that
sometimes
might be
can
true. If you're
really,
feeding, yeah.
especially with bedwetting, I find it if it's overactivity.
So that's
So
a good
that's
point.
just-
Are you giving your daughter too much pasteurized juices? Maybe.
Yeah,
I'll say this
maybe.
though. It sounds like you might be right onto her pituitary here, because bedwetting is a pituitary problem. But I'd also go to, in this day and age, and this little girl's 7, you know she has kidney weakness, you know she has adrenal weakness, and if she does it, she'll be one of the rare few, and it can't hurt to work on them anyway. So you really want to get this little girl's lymphatic system moving, because that's what's going on with you. Everything you tell me keeps leading me to your lymph system, not to hydrochloric acid problems and bicarbonate problems. You're taking me down another road here. Adrenals, shy, withdrawn, and kidneys.
Black under
Yeah,
her
there
eyes.
you go. You know, these are smart moms. These moms are
this is
learning.
great.
I love
I
these
think
mothers,
it's awesome.
absolutely. But I do not know what to do with the stomach. Here's the thing, and you're right on. So we just have this new stomach tea. Get this stomach tea and start drinking. You can get the Heal All tea. If you can't get this quick enough, I don't know what kind of herbs you have in your country, but if you can find things like marshmallow, slippery elm, these are anti-inflammatories.
Very calming.
The calming,
Yeah.
more calming would be your everybody drinks it. Flower chamomile.
Chamomile.
Absolutely.
Yeah.
Good.
Chamomile.
Chamomile. Yeah, that's soothing for smooth muscle only. But get the stomach tea or Heal All tea. It's got all the anti-inflammatories, the soothers of the mucosa. And let me tell you something. What I'm seeing here, again, is the same thing we're all involved in. Kidney weakness, adrenal weakness, the backed up lymph system all through the body. And sometimes we want to go to digestive problems or GERD problems because the AMA is kind of directing you there when it's worse. When you have systemic lymphatic constipation, that's worse. You can fix GERD by just staying away from proteins. Go into the pancreas, rebuild that, cool off the body, but you're burning, you're on fire, and my guess is that you're burning right through the wall. So either way, you want to cool yourself down. I'd probably cool myself down with vegetable matter first. I'd do the herbal teas that soothe and coat. I'd probably go to my green juices as opposed to the fruit juices for a while till everything kind of backs down. Simultaneously, I'm into the kidneys, I'm into the lymph system, I'm into the adrenal glands. I need more steroids, anti-inflammatories. I need all those too. Remember, your adrenals produces a whole bunch of anti-inflammatory steroids, or your corticosteroids, which you make a whole bunch of them, and the body can use either one of them. So get those adrenals up. That'll be helpful. You're going to start pulling calcium and cholesterol. So you want to get your adrenals up. What to do with the stomach. She also has the dark circles around pupils in her eye. Oh, used to have pains in digestive system. Well, I would suggest you guys get the Stomach and Bound #1. As long as you're pooping once a day, get Stomach and Bound #1 and take that on a regular basis. For an adult, 2-3 times a day. For a child, 1-3 times a day. It's not going to hurt you. It's soothing. There's a little hepatic and pancreatic nudge with the herbs in there. So I think that's a perfect formula to stay on and just start going after the wellness, going after what we talk about. You might have to stay away from the acid fruits. I would. Stay away from the acid categories of oranges, grapefruits, lemons, and things like that. Stay down. If grapes are too strong, which it can be, definitely can be. Matter of fact, we were just talking about, you can get so bad that you can't even drink water anymore. These are the conditions why I made that new stomach tea. And you're walking down that road, sweetheart, you want to stop and get this dealt with. Now, I would go more lymphatic because that's going to fix the pancreas too. If it is a pancreatic bicarbonate, it's going to fix that too. Because why? What would suppress the pancreas from producing bicarbonate? Going back to the lymph, going back to what affects cell functionability. Right? And it's always going to, you're not going to see blood do that. Blood is the kitchen. It's coming with all the goodies. It's the smiley face side. It's the acid side that's a frowny face side.
How do you regulate stomach acidity?
Yeah, why lots of people refuse to eat grapes or apples, saying that they get too acidic in their stomach.
Yeah.
Well, the problem isn't with the food, it's with the person.
That's right.
That's the problem. It's not with the food, it's with the person.
And isn't it worrying when a person cannot eat Mother Nature's best foods?
Yeah.
That worries me the most when they say, I can't eat fruit. I'm like, what do you mean you can't eat
Scary,
fruit?
isn't it?
Yeah.
Scary when you can't eat fruit. But you brought up something earlier I thought was really interesting. And I think if you take, for the young one, you take good, like Red Delicious apples, and you make your own fresh applesauce, and you have her eat that slowly of all the fruit that's acid, the apple's #1. Yeah. If I'm having a bad day and
pectin in there,
yeah,
so nourishing.
My God, papaya tablets. Of course, they sell those in the health food stores for digestion and stuff like that. But you've got to remove this inflammation. Well, what side of chemistry does the word inflammation and acid fall on? The acid side, of course. That's not a stress. So to stop acids, you can't eat them. You can't do anything with acids. You got to shift over to the base chemistry foods. Even the fruit is base chemistry, but aggressive base chemistry. Start with your greens. Do your green drinks. Get parsley, dandelion greens. You might even want to do a little beet in there, a little aggressive, but I think it'll be okay. Maybe a little spinach.
Cilantro?
Huh?
What about cilantro?
Cilantro, same thing. Parsley, cilantro, all your kidney and adrenal herbs, absolutely. And I think that'll cool, at the same time give you minor detox, maybe enough. Getting the herbs in there, then you can take care of all that with the herbs, and then you can go fruits and really honk on and get that lymph moving and clean the gums and the teeth and rebuild these tissues. Because you want to look at this. And if your 7-year-old is a pituitary down, she could be down also in thyroid, parathyroid, and adrenals. And a young child growing at 7 years old, you need that parathyroid.
Because they're just doing that big spurt now.
Oh, yeah. So you need those endocrine glands. That's why I recommend the endocrine gland formula, and watch them. Growing pains, calcium utilization problems, things like this. And with the pituitary, she might not grow as fast or as tall You know, if you hit it too much, then she could get big in places you might not want. So you want to, you know, you don't want to give any growth hormones or anything. You just want to go after the health of tissue, whether it's pituitary, adrenal, it doesn't matter. And it's all just a bunch of cells and two major fluids. Deal with the fluids. And so you'll be okay. Get that stomach tea. That's why I made the stomach tea in this case right here. Because you can get so bad. I don't know if you've had them in your practice, but you can get so bad. She's been practicing for a lot of years.
That's what I'm saying. They get so bad they can't even take a basic
Exactly.
fruit.
Can't even drink water. It's not even that. They can't even. Some people, we get them in here all the time. I can't even drink water. I just can't. I can't even eat it. I can't touch it.
That's really worrying.
And Dimitri, you know this one, Dimitri. Spoon feed. Teaspoon of herbs. Yeah. Okay, hold it in your mouth for a while and then swallow slowly. Another teaspoon of herbs in the mouth. Swallow slowly. You're going to have clients just like that. Yeah. And that's what makes you have gray hair early, besides poisoning and stuff like that. You know, the stress of bringing some of these poor souls that are suffering through those phases so they can have a life again. And this is classic stuff. Monica, thank you so much for that question. That was an important question. We have this problem all over the place, sweetheart. And whatever it takes, we'll work with you to fix this, but you want to get out of this because that leads to nothing good. You want to clean that up, and you'll be good, Mom. You got a 7-year-old. I can tell you're a good mom because you care about your daughter there, and we'll get her fixed up, and everything is good. Exactly, doing her homework.
And all her research.
Well, the folks from Lithuania, Romania, these are good people. These are all good people around the world. You know, it's the governments that are bad, not the people. You know. Here's one. I am 60, did a 47-day water fast. Woo-hoo! 60 years old, knocked it out of the ballpark. Who is this? Oh, this is Colleen.
Wow.
My God, honey. Wow, November 13th. And it did heal my hand and fingers that were injured in a fall. Wait a minute. How can you heal on a water fast?
Mm-hmm.
Interesting. You did great, sweetheart. This is fantastic. Also lost all my fat. That's what I need. A good 43 to 7-day water fast for me would just about take care of it. I had one severe panic attack during the fast as toxins were coming out. Yep. See, she already knew why. Yeah. See?
But that's good.
So and it was an overall stressful experience, even though I was not very active. No more hot flashes, though. You know, see, you did a lot. 47-day water fast, honey? I think you even kicked my butt. I don't think I've ever done a 47-day water fast, so you did very well. This is exactly what you do. I love these people. Aren't they great? Yeah. I mean, we've got some great YouTubers there. At 17, oh my God. Thyroid was removed at 17 years old. That's why I get so bent out of shape sometimes. I managed with T100 and Simplex F and the thyroid capsule sold through your clinic. Thank you. Plus selenium. Okay. Be careful with the selenium, sweetheart. That's your adrenal glands. Fix the adrenals and you don't have to worry about selenium. Now they're calling selenium a very dangerous metal. If you get too much of it, it's considered a toxic metal now. It's like, look at selenium. I am 5'7", 136 pounds, fine hair, otherwise fairly devoid of body hair. I have always had very weak vision. My tongue is always coated. Well, you know, that means your lymph system is always backed up. So that's what you do. You clean it until this baby is nice and pink. You know, and clean that up. That's your bowels, too. Remember, your tongue's just an extension of your GI tract. So what the tongue looks like, throat is down below.
Throat is down there. Yeah. That's right.
After the fast, I converted to eating raw and cooked vegetables and then into mostly salads. And now I eat organic apples, bananas, tomatoes, avocados. I really love avocados. Me too. Lemons, grapefruit, and hydrated organic raisins. Oh, I love hydrated organic raisins. I love those. One of my favorites. Okay, I put on a ton of weight in a health food store, but I had my own at one time, and I had raisins and almonds, raisins and pecans, raisins and pignolia nuts, raisin and pine nuts. I can eat them by the sack. Oh my God! Talk about weight. Oh my God! Occasionally, I crave a rotisserie chicken for the fat and skin mostly. Yeah, and I think exactly. I think if you look at that, most of us would rather have that fat part because of the fatty acid need that we have.
That's my favorite part of the chicken.
Well, think about this though. Fats are absorbed through what system? Not through the blood. Remember we talked about that. Your fatty acids are absorbed right into your lymph capillaries. So what? Wait a minute. Wait. How do your lymph system, if it's dumped in the inferior vena cava up here, how does your liver get these fatty acids? I mean, how does your body get fatty acids if your lymph absorbs the fats, which you know your blood can't? When you think about this, you'll know why. Well, you can't put lipids in the blood too much. So it's understandable that lipids would go into the lipid system, which is the lymph system. So are we selling the lymph system a little too short? Even we are? Interesting. I mean, I'm telling you, we think we know physiology, and I often wonder,
She still feels that she needs to detox.
Well, if her tongue's still coated, she would.
And her hot flashes are coming back, combined with emotional discomfort.
Well, you got awareness of your adrenal glands, honey, and so you want to go into the glandular for your adrenals, get the 400, see what your blood pressure is, but work on your adrenal glands. Sounds like you've got a pretty good handle on what. Oh, I do the Sedona method course. I don't know what that is. I know I like Sedona for emotional, mental clearing, and mostly unaware of fear, answer dominant negative emotions. Probably have control issues when I am currently.
We're working on. Yeah.
Well, yeah, you know what? Survival on this planet does require us to sometimes get aggressive and stuff. But, sweetheart, I think you got a good take on this. You're 60 years old. I think it's time that you devote your next 6 months or a year to getting into that lymph system a little deeper. And you're going to stack a lot of years on your life. I mean, that's incredible. Yeah. My bowels do not evacuate very often since I got off the more laxative vegetables. Well, you know what? There's that nervous system again from the adrenals. See the connection between the anxieties and that emotionals and not moving your bowels?
Total connection.
Total connection. Yeah. Neurological, autonomic nervous system. Yeah. Total connection, honey. Get the adrenals up, your nerves go up. Your breathing will go up. You won't find shallow, hard to take deep breath breathing, and that's what you get when you get into these areas as well. And then you can also get heart arrhythmias from this. Now, with that said, the lady with the stomach problems, she can have heart arrhythmias, she can have breathing problems because the stomach is the seat of the autonomic. So let me tell you, when you have stomach this acidic, you can have neurological problems, all kinds of weird things going all over the place because that's the seat going all the way up, remember, in the cerebellum and all the way. Mm-hmm. I really like living off fruits mostly, so do I, and I live in Connecticut. She's kind of like you. Yeah, except you're way on up her. We're just talking.
Try and get a good apple.
Yeah, so trying to get a good apple. Well, we were just talking because she's from Canada, and it's
harder. It's harder for my patients to get good quality fruits and veg.
I can see that.
Especially when we're freezing cold, we don't want to be drinking cold.
Well, that's the thing,
right? Yep. So what do you suggest, Dr.
Well,
Morris?
you know
what do you do?
Wrap up and drink warm teas and go for it because we had a lady, she's from New York or somewhere, all winter fruit. All winter. Fruit.
And
she kicked ass. And she just wrapped up and did it. And I said, that's the way you do it. And she did it. Right. But you know what? Pain and discomfort and happiness is a driver sometimes because it's sometimes hard to just change your mind of all these patterns. You want to, but, when you go to eat an apple, no, here's a hamburger, or whatever people fight with. When
you'll do whatever it takes.
Exactly. Yeah. That breaks up these thought patterns real quick and goes, you know what? Forget that. I'm going to take care of myself. And that's the driver. Pain is a driver into change. That's for sure. You have a great selection of herbs and tinctures, and whatever I think of ordering some, I stop because I have no idea which ones I could start with. So please describe. Okay, so Colleen, I've mentioned this over and over and over again. And it's on the videos, and you please can call in here, and they'll set you on a protocol for yourself. But these are detox kits, and it's so simple. We made it so simple just to help you. We just made this all simple. We have detox kits that are all designed to go into you and go, and they're up to date. We just updated our whole protocols. So you've got 2 lymphatics, 2 kidneys. However, the first 2 weeks is a little slower. 1 kidney, 1 lymphatic. But you want to go slow, as you were saying. You want to kind of open the door, say hello, stick your head in, then try to get a little further in, get a little further. Oh, this feels good. Oh, the sun is shining, the mother's hugging me, the fruits taste good. Oh, this is good. I like it here. It's okay. Right? You're not one of the millions that are finding themselves in allopathic curses. So you really, this is a great door to open. But like you said, it's a good point as you take your time. And if you're suffering, though, some of you can't take your time. Okay, hit it, knock it out of the park. Either way, you know. So I'll say this. Always go after your GI tract. So we have 5 stomach and bowel formulas. Generally, number 1 is all you need if you're moving your bowels every day, but you can use number 2 or number 3. We have all our lymphatic formulas are in capsules. All our lymph node formulas are in tinctures. And the reason I did that, and by the way, we have our new video soon to be out on all these herbs and why I made them, but the reason that these herbal bowel formulas are important, they're anti-inflammatories, they're bowel restoratives, they're not laxatives. And you want to find the one that just moves you gently and heals and makes you feel good inside. This detox should not be a radical experience, but don't make it difficult, keep it simple. You're after your lymph system, which includes the kidneys and adrenal glands. You're after that. That's your sewer system. So you're after the sewer system of the body. Why? That's all the acids. It's all the inflammation. It's all the swelling. It's all the tumors. It's all the cancer. It's all that side. You're going after your GI tract because that is very much a part of that whole system, but also GI tract cancers, let's face it, was number 1. All the food you put in hits that first. So all the meats, the dairies have wreaked havoc on the mucosa and of the GI tract. So restoration of the GI tract has been, and we have been involved in that for well over 150 years. As a matter of fact, the oldest books I can find of detoxification, early 1800s, all talk about bowel work, colon work. So, real important place to be, except we know kidneys, big issues as well. So, we're just talking about that. Your eliminative organs.
Yeah.
That's what you want to go after. Skin, thyroid, remember, sweating. Open up all your eliminative organs and watch the mucus come out. Because what did you tell me about a bucket of mucus you saw come? What was that?
That was earlier.
That was earlier. Someone got a bucket of mucus out of.
Yeah.
A bucket of mucus. And that's what you're going to see. You're going to see a lot of mucus coming out of you. Thank you, Colleen. Thank you so much, sweetheart. Listen, don't be afraid to start on the herbs and just call in. Don't be afraid to call into the clinic here. I know we're busy and sometimes you have to wait and but leave a message. If they don't call you back, I'm going to punch them in the nose. We're out of time. We're out of time. And here's James.
It's James.
Remember that? James again.
We covered that one already with the eyes.
Yeah, we covered that with the eyes and stuff. Hello, it's Tony, and I think we covered a lot of these. But it's the end of the day, and if I don't cut it off, they'll come in here and club me over the head. We love you guys. I tell you, I am so proud of each and every one of you. Keep working on your spirituality as well. And work on giving your friends hugs. Years ago, a friend of mine, me and him, we both became fruitarians together, and he said, let's just start hugging people. And I'm going, well, that's not a bad idea. So we just started hugging everybody.
How many miles to get my hug from you?
I know, and I'm going to give you another one. Oh. See, hugs all around. And so here's a big cyber hug to every one of you guys. I'm proud of you. Don't get frustrated. Relax. Like you were saying.
Have a bad day, don't worry. Tomorrow's coming, it's another day, and just step back up.
That's right. What's that other thing, if you have a bad day? I don't know, but do that. Just relax. Know that you're the most important thing.
Guilt is the worst thing in this.
If you cheat, so what? Go on. Go on. Keep on going. Who cares? Go on. Doesn't matter. We're not going to club you. No. Now, you might have some perfectionists out there that are ready to club you. Don't, because if you follow them around, you'll find almost everybody. Oh, okay. So you just can't think that way.
Just do the best you can.
Do the best you can, because so what? This is creation, guys. What's more important than this is you, and who you are, and how you find that conscious awareness of that. And even though one might not know what that even means, and what spirituality means or God means, who knows? Matter of fact, I've often said that it's almost better if you started and didn't believe anything and you just started to look around. If you've been watching that movie, The Cosmos, it's okay. I think they could have done a lot better, but it really brings in the realization of a creative consciousness. And this is what Isaac Newton said: you cannot have creation at this level without a conscious driver. In other words, a pattern maker, a creator. And that's true. When you look at a beautiful flower, or a beautiful woman, or whoever, you're going, my God. God. So don't forget that element. of who you are. And so you have fun, and we'll shoot some more videos as soon as we can. I love you all, and thanks so much for all your hard work on yourselves. You will not regret 1 minute of it. You know?
That's right.
That's right. So from all of us to all of you, bye-bye.
Bye-bye.